Welcome to Arirang TV's special coverage on COVID-19. I'm Min Sun-hee. While new cases in Korea have been hovering on double digits over the past few days, this is not the case for many of its partners near and far. Accordingly, authorities here are calling for and seeking ways to allow for concerted efforts to combat the coronavirus. We begin today with the headlines. As always, I have our Kwon So-ah and Noah Ram in the studio. Welcome.
Hi.
Hi.
So let's start with you. I understand cases here in Korea are still hovering on double digits.
Right, on double digits and around in the 50s. So that could be seen as a positive sign, which has also been mentioned by government officials for the second straight day. We started off the week with 47 cases on Monday, 47 again on Tuesday, and today we have 53. So just a slight rise from yesterday, but still relatively low compared to just a week ago. The total number of cases now stands at 10,384. The death toll has reached 200. That's 8 more than Tuesday. Now, going over to our map, Seoul has 11 new cases, Gyeonggi-do Province 6, where the total stands at almost 600, and Incheon has 4 new cases. So that means the metropolitan area has more than 20 new cases, and Daegu and Gyeongsangbuk-do Province have 9 and 3 cases, respectively. Officials say the mass infections that broke out in February in the Daegu and Gyeongsangbuk-do region is now dissipating. Now, as we can see from the regions, concerns are now shifting to cluster infections in the Seoul metropolitan area, as well as new cases from abroad. In fact, almost half of the new cases are imported cases, of which we have 24 today. 14 have been detected through enhanced screening measures at the airport. 20 of the new patients from abroad were South Korean nationals. Now, a large portion of people coming from abroad stay or live in the capital region, and sporadic group infections are still being seen at hospitals, churches, and other vulnerable facilities, so that remains a concern. Seoul Mayor Park Won-soon warned in his briefing today about the possibility of another wave of mass infections and called on continuous social distancing. And under that context, he ordered more than 440 entertainment venues like nightclubs to suspend their business until April 19th. And of course, April 19th is the date when the government extended its social distancing measures.
Right. What is the case like overseas?
Well, where also stricter measures have been implemented was in neighboring Japan, which declared a state of emergency over the coronavirus for Tokyo and 6 other prefectures. I think we have a more in-depth report on that later on. But also close to us in China, meanwhile, the lockdown imposed in Wuhan, the epicenter of the virus, has been lifted, with transportation services being resumed on Wednesday. Now, taking a look at the major outbreaks around the world, China, with its around 81,800 cases, has less cases of infections and deaths than many other countries now. The death toll in the U.S. has exceeded 12,000, suffering its highest single-day rise in deaths. The same goes for its epicenter, New York. Germany's total cases surpassed the 100,000 mark, and France has now over 10,000 fatalities. In the UK, meanwhile, Prime Minister Boris Johnson was said to have spent his second day in intensive care for treatment, but he is reportedly in stable condition. And those are the global updates I have today.
All right, Soa, thank you for that. Meanwhile, Aram, as Soa mentioned, there is continuing concern over imported cases given the rising numbers, that is, and the government has placed restrictions on overseas arrivals to the country.
That's right. The announcement on the new restrictions was announced by Prime Minister Chung Se-kyun in a pan-government meeting earlier today. Here he is explaining the measures.
South Korea will temporarily suspend visa waiver programs for countries imposing entry bans on Koreans and expand entry restrictions on foreigners traveling for reasons that are not essential and urgent.
Right, and as we heard, the measures have been expanded now, and the measures will be applied to 88 countries, in fact. And although entry bans haven't been imposed, the new move will make it certainly harder for foreigners to enter the country because they are not allowed the free visas that they enjoyed before. And the tougher measures, as come as nearly half of the new infections in Korea, as we alluded to earlier, come from overseas. And the tough measures are already in place. As we know, the mandatory 2-week self-isolation and quarantine for all overseas arrivals. But the Prime Minister said it's difficult to deal with more than 5,000 overseas arrivals coming in every day, so hence why there is the need for new measures. And the Prime Minister also hinted at possibly even more measures down the line with the surge in imported cases.
Right. Now, researchers across the world are looking for a vaccine treatment for COVID-19. I understand Korea might have made a breakthrough.
That's right. Korean researchers at Severance Hospital have discovered a possible cure for seriously ill COVID-19 patients using blood plasma from recovered coronavirus patients. And they say they have succeeded in treating 2 seriously ill patients, a man in his early 70s and a woman in her late 60s, after injecting the blood plasma from a recently recovered patient. It's thought that the plasma from cured individuals who have obviously developed antibodies from the virus could have benefits in treating others, but health experts are warning that large-scale clinical tests are needed to prove its effectiveness, as many experts have warned with other medical kind of possible treatments as well. And South Korea has successfully utilized blood plasma treatment before to deal with the 2015 MERS outbreak. There was about 9 people who were cured from the blood plasma treatment then. So I think they're looking at at this particular method to cure the COVID-19 now. And Korea CDC is set to announce guidelines for plasma treatment on COVID-19 patients in the coming days after gathering opinions from experts.
I see. Well, the US and China have been involved in a war of words, and the President, Trump, now is taking his anger or frustration out on the WHO.
That's right. China-centric is what he used to describe the WHO. He said the WHO is too China-centric. He said the WHO, quote, really blew it on its coronavirus pandemic response, suggesting he's looking into slashing US funding to the organization. And the president was following the lead of other Republicans who have accused the WHO of helping China cover up the initial coronavirus outbreak. But Trump himself has been facing some backlash as well for his somewhat lax approach in the initial stages of the outbreak. He also blamed the WHO for giving the US what he called a faulty recommendation about keeping borders open. As we know, on January 31st, the Trump administration announced travel restrictions on people coming from China due to the outbreak. Just a few days later, the WHO, as we know, said such bans were not needed. They actually encouraged cross-border movement, saying it's not the best way to scale in or prevent the virus from spreading. But the WHO is now urging countries to not to loosen their lockdowns that are in place out of fears of another surge of infections. And some European nations have been lifting their movement restrictions because they are seeing a little bit of a slowdown in new cases. And as Soa mentioned earlier, the Chinese city of Wuhan, where the virus originated, they've kind of made a celebration of the reopening of the city as well. And so that's why the WHO is kind of urging against that at the moment.
Right, it's asking us probably to keep our guards up, of course.
Right.
Right, all right, Noah and Aram, that is, and Soa, thank you for your highlights today. We are poised now to join the regular briefing by the Central Disaster and Safety Countermeasure Headquarters. Authorities are calling for continued careful attention to personal well-being amid concerns over cluster infections following news of at least 3 confirmed cases at a private drinking establishment here in the capital city. Meanwhile, some of our middle and high school scholars are scheduled to commence their school year, their new school year that is, with online classes tomorrow, that is Thursday. Virtual classes are new for most schools here in Korea, and observers believe that this new learning approach will encounter much trial and error in its early stages, but hope that it will take productive root in the course of time, of course. Here now is a briefing.
부본부장의 설명이 있겠습니다.
Let us now begin our regular briefing for April 8th, Wednesday, on the coronavirus outbreak here in South Korea. The total number of confirmed cases stands at 10,384. This includes 832 imported cases from overseas, and of them, 92.1% were Korean nationals. And of them, 6,776, or 65.3% of the total have been discharged following full recovery. We had 53 new cases yesterday, and 82 more people were released after full recovery. And unfortunately, we had 8 more fatalities yesterday. And here is a regional breakdown of the confirmed cases. And out of the 10 districts and provinces, we have no cases confirmed as of yesterday. And we believe that all of the regional outbreaks was hovering around the one-digit number, and about 82% of the nationwide infections are related to cluster infections. And related to the cluster infections, here are the breakdown. And in Seoul, at the late-night entertainment establishment at Gangnam-gu district, we had 2 confirmed cases, and we are currently tracing the contacts and carrying out epidemiological surveys. And at Gyeonggi-do province, at the Ujeongbu St. Mary's Hospital, 4 more people were confirmed, and we have a total of 52 patients there. And at the Daegu City's CG hospital for the elderly, we also confirmed a test of people who were tested positive, and there were 5 more people who tested positive. And right now we have a total of 14 confirmed cases at this specific hospital. And relating to the late-night entertainment establishment here at the Seoul City Gangnam-gu district, we are currently conducting the epidemiological surveys, and we believe this process is very crucial to identify any more cases, and we ask everyone to participate fully in the government's measures for the investigation. And we believe that no one should hide any and conceal any information, and if anyone breaches this, according to the law, they will be subject to 2 years of imprisonment or 20 million Korean won as penalty. Today at the KCDC, we touched upon the issues of the cluster infections and the damages that could be inflicted on the multi-use facilities, which are mainly the high-risk facilities, including religious facilities, the nursing hospitals and mental hospitals, as well as nursing centers. And these are the facilities with a higher ratio of people with underlying diseases, and we believe that they have a lower chance of fully recovering, and therefore we need to designate a special person in each of the facilities to take care of acute quarantine measures. And this person who is designated as the responsible employee need to carry out screening, body temperature screening on a regular basis, and check whether their people have any symptoms. And also they need to check the conditions of all of the outside visitors, and they need to accumulate a well-documented list of the number of visitors. And if there are people who have been on an international travel, we believe that they need to be taken out of the regular staff for a time being. And such intensified quarantine measures will be provided in details, and they will be implemented from the 12th of April, which is this Saturday. And starting from April 1st, the Korean government has mandated self-quarantine for 14 days for all of those who are arriving from overseas. We once again urge everyone to take part in our mandatory measures. And according to the law, starting from April 5th, we have more intensified laws for penalizing those who fail to comply. and those who breach the guidelines will be face imprisonment up to 1 year or fine up to 10 million won. And we ask for every one of your participation in the enhanced social distancing until April 19th. Last but not least, we have new announcements for the research and development. First of all, the medical practitioners who are fighting on the front lines to treat the patients, as well as the researchers who are on the front lines to develop and research on the therapeutics. We would like to express our gratitude once again. And unfortunately, we understand the fact that we do not have an effective vaccine or therapeutics against the coronavirus. However, globally, many experts and researchers are putting their utmost efforts to develop the therapeutics, and especially those here in Korea as well. And thanks to their efforts, we have had over 6,700 patients who have been fully recovered. As mentioned yesterday, we are developing new vaccines and therapeutics, as well as we are conducting blood plasma treatment as well. And all of these efforts are carrying out centering around the Ministry of Health and Welfare, and we have established a scheme for the facilitation of this research and development process. And we have designated the academic circles, medical experts, and we have garnered and gathered the opinions of many experts. And based on these, we are putting all of our efforts on in developing possible vaccines, and we are currently sharing all of the genetic information with all of them, and we will also continue to intensify our cooperation. In order to overcome the coronavirus outbreak, our mid to long-term goal is to have a consistency in the research, and we need to also inject a sufficient amount of research budget. And the researchers at the Korea National Institute of Health, we would also spare no efforts in providing them with support. Thank you very much.
Right, that was the Central Disaster and Safety Countermeasure Headquarters with the latest facts and figures on COVID-19 here in Korea. Total infections in the country stand at 10,384, with 53 new infections as of early Wednesday, with 24 of those being imported cases. Health officials have reiterated calls for continued social distancing and avoiding of crowded indoor as well as outdoor activities until the 19th of this month to ensure that containment efforts stay on path. Meanwhile, Japanese Prime Minister Shinzo Abe declared a one-month state of emergency yesterday in 7 areas across Japan, including the capital, Tokyo, in response to the rapidly escalating COVID-19 outbreak in the country. Medical experts, however, are debating whether Tuesday's move came just in time to prevent a disaster or whether it may be too little too late. Here now is a video by a Japanese journalist about the situation in our neighboring nation.
先ほど諮問委員会のご賛同も得ましたので、特別措置法第32条に基づき緊急事態宣言を発出することといたします。
Hello, my name is Yonemura Koichi. I am working for Mainichi newspaper in Tokyo, Japan. The most shocking development here in Tokyo is the cluster infection that occurred at a very big hospital in Tokyo, where around 140 people became infected with the coronavirus. The hospitals in question sees more than 1,000 outpatients a day, so we could see a sharp rise in the number of new cases. And also, Japanese-style nightclub and bars are also being viewed with concern in regards to the COVID-19 outbreak. Tokyo metropolitan government is strongly urging people not to go to such place for the time being. And like in other countries, there is also shortage of masks here in Japan, and they are not easy to buy. So on April 2nd, Prime Minister Shinzo Abe announced plan to distribute 2 cloth masks for every household in country. But the measures have been criticized by many of the public. I think it was an example of very poorly planned public relations. Prime Minister Abe that day was supposed to explain big fiscal package to stimulate and support the deteriorating Japanese economy and household budget, but unfortunately he started talking about 2 cloth masks. South Korean mass testing is coupled with strong tracking measure, including the use of mobile phone data and credit card history. And that is impossible to straightly adapt in Japan right now. South Korea and Taiwan have both experienced infectious disease in the past and have developed countermeasure for some years. So Japan should adopt some of the South Korea or Taiwan method and make them mixed with its own original method. That's what I think. The fight against COVID-19 will continue for months from now, I believe. So I believe that there is plenty of room for us to cooperate between each other in near future.
And let's hope Tokyo is able to weather through its worst in the near future. Information is key in dealing with crisis, and we ask our viewers to reach out to us should you have any that you would like to share. Meanwhile, the aviation industry's attempts to stay airborne continue amid the pandemic, with Korean Air calling for a 6-month leave of absence for at least 70% of its workers, starting from the 16th of this month. Now, this brutal reality is true for airlines across the globe. And for more on that, we have the communications manager for AirAsia, Kim Min-jung, on the line from Kuala Lumpur. Hello, Min-jung.
Hello there, Sunny.
The aviation industry has been witnessing a free fall from the pandemic, Min-jung. Some airlines face bankruptcy, others are on the brink of bankruptcy. How has your company been faring so far?
Well, as you can imagine, many airlines in this region have suspended their flights, with governments around the world imposing strict border closures and travel restrictions. And many airlines in Malaysia have indeed grounded their flight. In the case of AirAsia, our cargo operations have been actually, since the very beginning of the outbreak, delivering medical services, medical supplies, and donations to China and Korea. We continue to operate numerous charter and rescue services to bring home hundreds of stranded people overseas, as we've done so a few weeks ago in Italy and Iran. And recently, we launched what's called an SOS campaign to help ailing local businesses to promote and deliver their products on our platform, airasia.com. And the AirAsia Foundation is also running a donation campaign. And for our customers, we're offering extended flexibility options, including unlimited flight changes, as well as offering credit accounts to be redeemed within 365 flights. So, but the bottom line is our focus is to ensure that our operation is robust to weather this crazy pandemic, really, and to get back on our feet in due course.
Min-jung, observers believe that the fight against COVID-19 will be a long one. How are you preparing for this lengthy war ahead?
Well, we have a lot of contingency plans that in place, that when people feel comfortable enough to start to travel, that we can offer good services for them, safe and especially with disinfectant measures that we have in place.
Minjung, it appears that cases in Southeast Asia are on the rise, especially in Malaysia, where you are. What can you tell us about the situation on the ground?
Well, Southeast Asia, as you know, many had hopes that the relative low cases in infections in Southeast Asia maybe was hopeful evidence that the hot and humid climate in this region might be helping to suppress the virus. But in recent days, countries in this region, including Singapore, Indonesia, and Thailand, are seeing some infection spikes. So hopes that temperatures could limit the spread of the virus have largely been dashed. And if you look at Singapore, for example, which had been initially praised for monitoring and isolation of infected patients, is now grappling with an increase in the number of cases in local transmissions and unlinked infections. And as of Tuesday, the number of cases added 106 from the day before to almost 1,500 cases and 6 deaths. So Singapore has implemented stricter restrictions on both inbound and outbound travels, as well as domestic movement within the country. In fact, today is the second day of the stay-at-home order, which will continue until the 4th of May. So for about a month, residents and citizens are asked to stay home and only leave their household when this is absolutely necessary. And most workplaces are closed except for essential services and key economic sectors. And schools have also moved to home-based learning as well. Over in Indonesia, this is, as you know, the world's 4th most populous country. It's seeing its coronavirus death toll at 2nd in Asia, only to China. It actually only registered its first case in March, but now, as of Tuesday, the number of cases stands at 2,738, with 221 deaths. And a state of emergency was declared on March 20th for 2 weeks in Jakarta. So schools and shops have been closed for the foreseeable future, and entertainment spots and roads are quieter than usual. And in the Philippines, there are roughly 3,700 infection cases with 177 deaths. So more than 50 million people are now living under lockdown imposed by President Rodrigo Duterte. He's been very proactive in closing down his country, both inbound and outbound, banning mass gatherings in schools and shopping malls as well.
Minjung, given that grim reality, there is concern that the healthcare system in Southeast Asia may not be able to handle a surge in the number of patients. I mean, given the reality that countries with very highly developed healthcare systems have also crumbled under the virus, what are your thoughts?
Right. I mean, as we can see in Europe, I mean, who would have thought that they would be overwhelmed in New York to see it being so overwhelmed by the sheer number of patients, right? Malaysia is one of the richest countries within Southeast Asia, and its medical system is efficient with sophisticated infrastructure. It is gearing up for an anticipated wider breakout of cases by transforming the exhibition halls to temporary hospital, and the facility is just outside of capital Kuala Lumpur, and it's been fitted out with beds and equipment. But the bigger concern in Southeast Asia is really probably in places like Indonesia, where even in good times, its healthcare system is rather poor, especially in remote areas. And Indonesia, as you know, Sunny, is made up of 17,000 islands and islets. So delivering quality medical care to remote places would pose a challenge for the country. And according to the WHO, on average, there's just one hospital bed per 1,000 people in Indonesia. That's compared to South Korea has 11 times more hospital beds, and 2017 figures from the World Health Organization shows that Indonesia had 4 doctors per 10,000 people, whereas South Korea has 6 times more per capita basis. So Indonesia also has one of the lowest health expenditures in the region. So not the most ideal medical situation, if you will, and perhaps why the governments in this part of the world are implementing really strict lockdowns for its citizens so that they don't overwhelm the hospitals when this breakout becomes larger than is necessary.
Right, those are very alarming figures, of course. All right, Min Jung, thank you for taking the time to talk to us. Do stay safe there.
Thank you.
Avant la crise, nous produisions en France 3,3 millions de masques par semaine. Fin avril, nous serons à plus de 10 millions. Nous aurons plus que triplé en quelques semaines.
The COVID-19 pandemic has also shed light on various cultural factors that may be at work in either starting or stemming the spread of the virus. For more on this rather intriguing element of cultural norms in the East and West, we have Professor Park Byung-ju from Seoul National University. Welcome, Professor Park. And we have Sebastian Felletti, Asia correspondent for La Figaro of France. Hello, Sebastian.
Hello, good afternoon.
Now, we'll start with you, Professor Park. The government here has been highlighting the necessity of face masks in the fight against the pandemic. Do you believe that the use of face masks in this part of the world has served a great purpose in curbing the number of infections?
Yes, I think so. I think there is 3 ways of prevention by face masks. The first one is to prevent from the coronavirus from inside of human body to other people by capturing the coronavirus contained droplets produced by sneezing or coughing of the infected person. So it prevents from the body of the infected person to other persons transmission. Second one is prevent from outside to inside the body. By wearing mask, the infected person's droplets are not prevented to inhale to our body. The third way is to covering our face, especially nose and mouth, and the transmission of by our hands unconsciously touch our face is prevented. So 3 ways of preventing the transmission of coronavirus.
Right, and before we go any further, Sebastian, what is the general perception of face masks in Europe?
Well, until this crisis, as you know, for many, I think, European, wearing face mask was seen as something very rare, like an anomaly. I mean, of course, they will see like Asian tourists coming to Europe wearing face mask, and they will look at this with a bit of bewilderment. They didn't really understand what was the importance of this mask. So I think the crisis that we're going through now could be a game changer, because it's really people. I can see in a country like France over the last months, over the last 4 weeks, the change of perception is quite dramatic on mask. From 1 month ago, people were still in denial, but they were in denial also of the gravity of this crisis, of this epidemic, and gradually they've been starting to realize that this is a serious matter, and now they're looking for masks. But the big problem is that there's no mask. So now the issue of the mask has become a hot potato, a political hot potato in France, and an embarrassment for the government, for example, of President Macron, because at the beginning the government has been saying masks are not necessary, and now we can see they are flip-flopping and they are starting to change their doctrine, doing a U-turn, and now starting to say that actually masks can be useful. And of course, the general public is highly critical of this shift because they say, what are you talking about? Why are you changing your view on this? And one of the reasons why they're changing this view is that before they didn't have masks anyway. They didn't have the capacity. They didn't have any strategic stocks anymore. So now, the past few weeks, the French government is rushing to make huge orders in China mainly, around the world, to try to source masks. And hopefully in the coming weeks and months, it could serve hospitals, which are still in shortage, doctors, which is also quite a shame in such an epidemic. And now we're opening the door to potentially in the future having a general population wearing those masks.
Right. Staying with that mask issue, Professor Park, do you suppose that perhaps we are here in the East, I mean in Korea especially, we wear masks to prevent ourselves from fine dust pollution. It's nothing new. The perception in the West may be different, do you believe, because they're not used to wearing a mask in general?
Yeah, I think there's big cultural difference between Korea and Western countries. And in Western countries, about 100 years ago, the catastrophic epidemic known as Spanish flu, correctly, the pandemic 1918. The pandemic was big size and the estimated deaths, the number of estimated deaths was 17 and 50 million people at that time. But the Western countries people regards the person with facial mask is very seriously ill patient. So they do not want to wear masks when they go out.
You give the perception across that you're very ill.
Yes.
I see.
That's a kind of, stigma. Mm-hmm. But in Korea, we have experienced several epidemics in 2003, SARS, and 2015 MERS. But in addition to that, we have experienced heavy air pollution. So people want to protect from their health from the coronavirus as well as fine particulate matters. So it's the same similar situation. So our people is well adapted to wearing face masks.
We're more used to it then.
Yes.
Sebastian, the situation in France is also quite severe right now. You have more than 10,000 deaths from COVID-19, and the government has now discouraged even greeting methods in your country. Tell us a bit more about the situation in France.
Well, the situation in France is now very serious. The France went into a total lockdown now almost 3 weeks ago, and that was quite an abrupt change because until early March, the government was still very relaxed, reassuring, and I think they didn't see this epidemic coming, so they had to make a kind of a drastic change. And now the entire population is in lockdown. It's extremely severe. You cannot go out without a document to show to the police. You can only go out once a day to buy some food. It's very strict. And of course, the main objective of this is to, as we say, to limit the increase of the so-called curve. And now hospitals are being overwhelmed by cases in some of the cities of France. And that's the main concern, is that you cannot admit some of the patients because you don't have enough breathing material. So that's the big question. Is the coming days are still going to look very grim. The question is how long this lasts. Everybody's watching Italy. Italy is the most damagedly hit country in the world now, in Europe, and the question is whether other countries like France, Spain are going to follow the same curve. It looks like there are also some signals that maybe it wouldn't be as bad as that, but the general situation is extremely serious, and the question is how long it's going to last. And also I think there's a perception that this confinement, this lockdown phase is going to last several more weeks, but the key question here is what happens next. And the example we see in China is that after lockdown, we're not coming back to normal. It's like a second phase where life will slowly come back to normal, but with huge constraint on a daily basis, because there will be always a risk of new infection. And that's the thing people are starting to come to terms, is to realize that actually we embark on a very long-term crisis with huge economic, social implication, because we're not going to come back to normal in 1 or 2 months. Probably the entire year is going to be under the influence of this coronavirus major crisis.
It's going to be a long battle ahead.
Yeah.
Professor Park, just out of curiosity, do you believe that perhaps practices in the West, such as greeting by kissing people on the cheek, or entering homes with your shoes, because I understand there was a research that showed that the virus could live for about 5 hours, is it, on your shoes? What are your thoughts?
Yeah, I think that the customary practice will increase the risk of infection, because close contact is one of the most important risk factors. And the second one is wearing shoes indoor. You know, many of the Western countries' house is indoor is covered by the carpet. So the contaminated shoes from outside environment to the indoor carpet, the carpet is contaminated with the coronavirus, and the indoor dust from the carpets contained with the coronavirus and can increase the risk of coronavirus transmission. So I think that will contribute somewhat for the epidemic of the coronavirus COVID-19 in Western countries.
Do you suppose that kind of reality, Sebastian, could perhaps discourage people from wearing their shoes inside their homes?
Well, on the shoes, I cannot tell exactly, but what I'm sure is that when you look at the figure of the number of dead people in Europe and US compared to what we've seen in Asia, there's clearly a massive differences, much more victims over there. So there must be some reason. Of course, one of the key reasons is the quick response from countries like Korea, Taiwan, who quickly took that crisis seriously, which preempted to have a massive situation like we have over there. But of course, some habits, like daily habits, are definitely having an impact. And I think it has to be put in a wider social context, which is cultural differences. Like, for example, the mask. You know, I think also people didn't understand in Europe why you wear the mask, while I think here in Asia, in Korea, people wear the mask not only to protect yourself, but also you're sending a signal to the other people. I don't want to infect you. I'm paying attention to you. I'm paying attention to my social environment. So it's a different background. But what is really interesting is that these kind of crises we are going through, these are the moment where your habits can change. I think at the moment everybody is in emergency mode. So a lot of people are changing their habits, and obviously for people staying home, stuck home is a massive change. But I think some of the change will be more long-term. There will be some new habit, and as you say, like shaking hands. When are we going to start to shake hands again in France or in Europe? I'm not sure. Maybe at least for several months or a year or two, and then who knows if we get back to it. These are open questions. Nobody has the answer, but I think these are very unique moments where some habits can transform themselves for long term.
Sebastian, the government here has been receiving quite a bit of attention for its transparency in dealing with the COVID virus. But that's also been a bit of concern about how we disclose all information about confirmed patients, where they've been. These are infection parts. And there's talk that this is an infringement of human rights. What are your thoughts on this?
Well, the tracking, of course, the case of Korea and Taiwan is a very much looked after now in Europe. And tracking, of course, seems to be one of the key components of the way these countries have been successfully dealing with the epidemic. So I know that right now the French government is openly looking at that option. It's discussed by the secretary among even the presidential office. There's a discussion open these days. And of course, it's triggering, as you said, a wide debate, a sensitive debate, because some people argue you cannot open the door to a big brother watching you. So the question here that is really important is to show if there's enough legal safeguard. And what is important in this debate is to show whether a country like Korea, which is a democracy too, is able or not to to prevent this to turn into a mass surveillance. So, and we have an issue here because, you know, there's another country nearby who is doing this on a huge scale, which is called China, which is a dictatorship. And some people in this debate might mix everything. They say, oh, you know, this is the way to do it. And actually, Korea has a legal framework that tries to make these cases very exceptional. So the whole question is whether you can find a way to show that as a democracy, you can, in exceptional time, use these data and meanwhile protect the privacy. That's the big challenge. And
of course.
It's a very sensitive political debate. It's only opening now, but they have to have an answer quickly because if they want to use it, they have to be able to use it just after the lockdown.
Of course. Professor Park, do you agree with Sebastian's view that this contact tracing, etc., may have actually served to reduce our infection numbers? Because Koreans have been very good about following these government regulations and from avoiding these areas. What are your thoughts?
Yeah, I agree with Sebastian. One of the most important measures to fight against epidemic is to detect the infected person as soon as possible and quarantine them effectively. In that aspect, to look at the movement route and announce it, and which will help to detect the contact persons and who are infected or not. So it's very important and effective measure. And now we are fighting against the COVID-19 epidemic. So it is inevitable to constrain some part of private rights for the public good, which is to save our citizens' lives. But it should not be continued after cessation of the pandemic.
After the pandemic ends, we'll go back to normal life, hopefully, hopefully in the near future, hopefully. All right, that is all the time we have for now. Professor Park and Sebastian, thank you very much for being with us today.
Thank you.
Thank you.
Right, like I said, that's all the time we have for now. We'll see you tomorrow at the same hour with the latest updates on COVID-19. In the meantime, Arirang TV welcomes your thoughts and inquiries on our social media accounts or on our homepage, arirang.com. Thank you for watching.